Good morning, everyone, and welcome to this webinar. My name is Senzekile Bengu. I am a researcher at the Institute for Security Studies, and I'm also the convener of the Violence Prevention Forum. And the Violence Prevention Forum is a multi-sectoral platform where we bring together researchers, NGOs, policymakers, development partners, and the private sector to share knowledge and research on what we know about violence and what interventions work to prevent violence in South Africa. And we do this with the aim of ensuring that evidence and best practice influences policy and interventions aimed at addressing violence in South Africa. And I will be chairing today's webinar. And before we start, please note that this is a public event being broadcast live on YouTube. Therefore, Chatham House rules do not apply. Today's webinar will focus on substance abuse as one of the key drivers of violence. And this is a fitting topic and a discussion as we mark the end of 16 days of activism for no violence against women and children, and we begin the festive season. As we know, South Africa faces high levels of violence, and alcohol abuse is one of the key drivers of violence against women and children in the home and in communities. And what's more concerning is that if we look at recent studies, they are showing high levels of alcohol consumption and substance abuse amongst young people. In 2022, Planet Youth did a pilot study in the Western Cape and George with 631 learners who are in grade 8 and 9, and they were looking at their well-being. And what they found is that 47% had been drunk in their life, 29% had tried alcohol before they turned 13, and 42% had used a hookah pipe in the past 30 days. And the latest Child Gauge, the 2025 publication, which is South Africa's biggest publication looking at children's well-being, also identified alcohol and substance abuse as one of the key factors and drivers of intimate partner violence and violence against children. Therefore, we know that to prevent cycles of violence, we need to address substance abuse in homes and amongst young people. And we need to invest in understanding the problem and drawing on effective strategies that have proven successfully both locally and globally. Because substance abuse is not only a South African issue, it's a global issue that is experienced by various countries, for example, Iceland, and they also have had to grapple with the issue, and we'll get to hear about some of that today. I'm excited that in today's webinar, which will be an hour and a half long, we will get to hear from two speakers, two researchers, who are representing two organizations that have been working to understand and tackle this issue. We will get to hear what we know about substance abuse as a driver of cycles of intimate partner violence and femicides, and what works to address this issue. The Planet Youth survey that I spoke about was actually expanded to the whole of the Western Cape, led by the Violence Prevention Unit in the Department of Health and Wellness, and it now involved 49,000 learners. And we'll get to hear what these provincial results are telling us about young people's use of substances and what can work to address this. And after our speakers, we will get to have an interactive Q&A session, which I hope will be a very rich discussion. While our speakers are speaking, please keep your microphone on mute. But for those who feel comfortable, we would be happy for you to keep your camera on, as it would be lovely to talk to a room full of faces. And with that, let us begin. I would like to introduce our first speaker, Dr. Leane Ramsoomar. Dr. Leane is a public health researcher at the Gender and Health Research Unit at the South African Medical Research Council. She holds a PhD in public health and has over 23 years of experience in health promotion and public health research and implementation. And she's focused on areas of alcohol and drug use, violence against women and children, and their intersections with alcohol. She serves and has served as a faculty at leading South African universities, such as the University of the Witwatersrand, the University of Pretoria, and has been a guest lecturer at the University of Johannesburg. And today we are very pleased to have her sharing a presentation on the role of substance abuse on gender-based violence and driving femicide. Over to you, Leane.
Thank you very much, and good morning. Thank you, Senzekile. Good morning to all of you attending this webinar. Thanks for that very kind introduction. I'm just going to project my presentation, and then we'll get right into it. Okay, I'm assuming that this can be seen. Can I get an indication that it's in slide mode? Yes. Thanks very much. I'm very, very privileged to have been invited to speak on an area that is quite dear to me. I'm quite passionate about this area and have been working on it for a number of years. I'm also very pleased to share a platform with Hellen this morning, so thanks very much for that. I'm going to get right into the presentation, which is going to look at the role of alcohol and substance use in gender-based violence and femicide. I don't think that it's a news to this audience that gender-based violence is a serious public health problem affecting at least 1 in 3 women globally. I think Senzekile has provided a very, very accurate picture of the 2 major public health problems that we face in South Africa, one being gender-based violence and the other harmful alcohol use. Femicide is also something that we face as a country and is the most extreme form and outcome of gender-based violence. With intimate partner femicide, that is when a woman is killed by an intimate partner, such as a husband, boyfriend, ex-boyfriend, and it is the most common manner in which women in South Africa are killed. Sadly, South Africa has the dubious distinction of having the highest femicide rate in the world. We sit at 5 times the global average. And we really need to be thinking quite seriously. And I think that the recent groundswell around gender-based violence and femicide that we've seen from movements like Total Shutdown, from Women for Change, etc., has really been an indication to us about the rage and the anger that we as a nation experience because of GBV and femicide. Now, among the many drivers of gender-based violence, alcohol has been identified as one of the key risk factors for intimate partner violence. And this hasn't always been the case. The role of alcohol in gender-based violence has actually been contested for a long time. However, in the last decade or more, we have seen increasing evidence of the consistent relationship between alcohol and gender-based violence, particularly intimate partner violence. And I often like to quote Leane and Quigley from 2017 work, who says it quite nicely. He says, while neither a necessary nor a sufficient cause, excessive alcohol use does contribute to the occurrence of partner violence. And that contribution is approximately equal to other contributing causes such as gender roles, anger, and marital function. So yes, we acknowledge that in fact, there are several other drivers such as patriarchal norms, gender norms, and social norms that drive the pandemic of both alcohol and IPV. However, we do now need to recognize and can no longer ignore the salient role that alcohol plays. There's also evidence that other substances are also recognized as risk factors for gender-based violence and femicide. And while the evidence on IPV is now clear, less is known about there's been much less research on the role of other substances on GBV. When it comes to the evidence base around IPV, we know from global as well as local research that perpetrator alcohol use is a risk factor for IPV, that there is definitely an association and that it needs to be considered as one of the key drivers of IPV. We also know that, that the use of alcohol also increases the frequency and the severity of intimate partner violence, meaning that when a perpetrator is alcohol affected, he is likely to more frequently perpetrate IPV against his partner, but also to more severely do so, often resulting in injuries to the survivor. Similarly, illicit drug use, particularly methamphetamines, mandrax, and cocaine, increase the risk for IPV. Now, when we come to the issue of alcohol and femicide, so moving away just from the IPV link, alcohol has previously been linked with a femicide. However, the research on this has largely emerged from high-income countries, and evidence from low to middle-income countries has been quite limited. And this, for us as researchers and practitioners working in South Africa facing these two huge public health challenges, reveals a significant research gap, but also a significant practice gap. And so I'd like us to think about that as we mull over this morning's proceedings. From the evidence, and we conducted a literature review looking at the link between alcohol and femicide, the evidence base revealed 5 studies that looked at this link. The first dedicated femicide study, which was conducted in the United States, was a multi-city study. And that study showed that perpetrators with problematic alcohol or drug use had 2 times higher risk of perpetrating femicide or attempted femicide. When we looked at results from a meta-analysis, that showed that alcohol and drug use increased intimate partner femicide risk by 85%. That is a substantial amount of risk. And this really emphasizes the impact of substance use on femicide. However, a 2022 study, which included, a 2022 review, which included 24 studies from high-income settings, did identify alcohol use as a risk factor, but only in 5 of these studies. Remember, these are also limited to high-income countries. And again, we need to be looking at the picture much more closely in low to middle-income country settings. The 4th dedicated national femicide survey, which was conducted here at our unit within the Gender and Health Research space at the South African Medical Research Council, was conducted in the first year of COVID-19. And this was when the alcohol sale restrictions were first implemented, and this presented us with an opportunity to establish the impact of alcohol restrictions on femicide. So I'm going to be talking a bit about that this morning. But to go back to the evidence for the link between alcohol and IPV, robust quantitative data has shown us that alcohol is a major driver of GBV in South Africa. If you look at these 2 graphs from 2 studies that we conducted in large informal settlements and peri-urban settlements in South Africa, the one being the Stepping Stones and Creating Futures trial, which was conducted in eThekwini municipality, as well as the Sonke Change trial conducted here in Diepsloot in Gauteng. Both of these studies showed very high rates of harmful levels of drinking. Now, when we talk about harmful levels of drinking, we quantify that as 5 or more drinks in one sitting by men, and often referred to as binge drinking or episodic drinking. And in these 2 studies alone, we found that between 64 and 69% of men drink, and of those, 39 to 44% across the two sides drank at harmful levels. This is very much in keeping with what we see in the World Health Organization status report on alcohol, that South African men are among the highest binge drinkers in the world. Not good news. Further to that, between 40 to 50% of men perpetrate IPV, and between 35 to 39% perpetrate non-partner sexual violence. The graph on the right-hand side basically shows you that the more harmfully men drank in these 2 trials, the higher the odds were that they perpetrated violence. So in the Stepping Stones and Creating Futures study, you could see there was a 2.32 increased odds of men in that study perpetrating violence, intimate partner violence. And the same was true for the Sonke Change trial. Now, I'm unable to see my statistic on the block because of Zoom and its multiple windows. However, we have found from other global research that across 28 countries, that there was a more than 2 times increased odds of women who had experienced IPV when their partners drank. So the evidence is quite clear. And of course, this is not at all an exhaustive list of evidence. I think it's also important to state that evidence for the link between alcohol and IPV can also be investigated qualitatively, and we've done some of that work as well. In particular, looking at alcohol's harm to others, and in particular, alcohol's harm to women and children from men's drinking. And these are often captured from qualitative stories that we hear from women. When we look at the evidence for the association between other substances and IPV, again, a much more limited database, but here a review of existing research on the association between methamphetamine use and domestic violence found that GBV is high among methamphetamine users. Similarly, in a study in the Western Cape, 360 participants, 28%, that's almost a third of men perpetrated IPV. Of these, 90% were amphetamine dependent, and the percentage were also severe methamphetamine dependent. When we looked at another study in the Western Cape, this illustrated for us really the bidirectional relationship between GBV and substance use. So exposure to gender-based violence actually led to an increased use of drugs. And this is not surprising. People often use drugs and alcohol to cope with the trauma of having been victims or survivors of gender-based violence. And this was predominantly in this study among methamphetamine and mandrax users. So findings from this study found that the experience of GBV was actually associated with an increased likelihood that the women who experienced it actually went on to use drugs. And it's important also to see the other side of the directionality. As I said, it's important to hear sometimes also the qualitative voices. And when we looked at studies that looked at alcohol-related violence, I'm not going to read through all of them. This 28-year-old female victim said, "For me, my worst experience is one time he went away," and she's speaking of her partner, "for days. And he came back very drunk. He demanded to sleep with me. So when I refused, he just physically beat me." But prior to that, she talks about how he drinks on a daily basis and beer is everywhere. So she talks about basically the ubiquity of alcohol in their community, but also the impact of on her personally. If we look at the male perpetrator, he recounts, "When I'm angry, I call my wife and talk to her about what she's doing. When she argues and assumes she's right, this increases my anger. I just keep quiet. The next day, I come back with a full tank of drink and hit her to make her believe that I am the head of the family and it's me who makes the family decisions." And here again, you can see the intertwining of the use of alcohol with patriarchal norms and how those intersect to actually result in IPV for this couple and many other couples. In terms of the illicit drug-related violence, we also saw on the right-hand side, I'm not able to see my quote very clearly, but the female survivor talks about how her partner gets high on tick, and then once they get off the tick high, then move on to alcohol so that they can get a different high. And so this really speaks about the polysubstance use that is happening. And this again is something that is quite common. So they go from one substance, one drug to another drug and to continue the trip. And she talks about how this results in fighting and abuse. And then a male perpetrator, also under the influence of alcohol, talks about how I started beating her up so badly, her whole face was swollen. And I was just, can't see the words, I was really angry. I really regretted doing that. And so he talks about both the admitting how severe the violence was that he had perpetrated against his partner, but also the remorse that goes with that. And often probably explains the cycle of violence that we see is the act of violence, the remorse, the forgiveness, and those types of things in coming back. So I'm going to move on to the evidence for the link between alcohol and femicide during the COVID-19 bans in South Africa. And as I said, our unit conducts the femicide studies, and we are able to, through the fourth femicide study, overlapped with the COVID-19 period, during which we were basically provided with a natural experiment to be able to look at the effect of alcohol on femicide in South Africa. So I just want to remind everyone that almost about 6 years ago now, we were living under very different circumstances, circumstances where we lived under various levels of lockdown. And here, just to remind everyone, the first lockdown level started on the 27th of March and ran till the 30th of April 2020. And this was called level 5, during which there were no alcohol sales. You will recall that this decision was made quite quickly, without any warning, and implemented immediately, during this period. That was accompanied also by the complete stay-at-home curfew. So everyone was expected to stay at home, with the exception of being able to go out just for a short period of time to purchase food and to seek healthcare. And that was what we call the hard lockdown. We then moved down to level 4, again, during which no alcohol sales were allowed, but a night curfew was introduced where people were able to move around between 8 o'clock at night, needed to stay indoors between 8 o'clock at night and 4 o'clock in the morning. And then we went down to level 3. Now you will see that the alcohol sales ban here changed somewhat. Alcohol sales were again permitted, but with some conditions. There was no on-consumption alcohol, so you could not drink the alcohol where you purchased it. It needed to be bought and taken off, and there were restricted hours of sale. Then in level 3, we had a modified lockdown period again, where we had no alcohol sales again. And then we had a night curfew. In level 2, we had alcohol sales with some restrictions and conditions, and the late night curfew stayed in place, the late night curfew having moved from 11 till 4 o'clock. So people being allowed to stay out for a bit longer. And then in level 2 and level 1, the period between August and December 2021, some alcohol sales permitted with conditions and a late night curfew. Many of you will, given the multiple iterations of the lockdown, will recall that quite shortly after Christmas in 2020 and before entering 2021, there was again almost an unannounced no alcohol sales. And this was really in anticipation of the celebrations that are associated with ringing in the new year and all of the alcohol consumption that happens during that time of festivity. The other period that you might remember, and the stark picture that remains in my mind, is the one that shows the photograph in the newspaper of an empty trauma room, and how the restrictions on alcohol had actually led to trauma rooms at big hospitals like Chris Hani Baragwanath Hospital, which would otherwise have been overflowing with trauma and injury cases, being completely empty, and nurses and other medical staff talking about the amazing effect that the alcohol ban had had on trauma. So I think I've painted the picture around those lockdowns. But just to move to the COVID study and, well, the femicide study that coincided with COVID, I just firstly want to go quite slowly on the slide and to say that each of these horizontal bars represent a number of cases of intimate partner femicide per week. And this ran for 52 weeks so the study covered 52 weeks between the 1st of April and around the end of March. That is a year, not a calendar year though. So each of these horizontal bars representing the number of intimate partner femicide cases. Now recall that when we do femicide studies, we look at overall femicide rates, we look at intimate partner femicide, and we look at non-partner femicide. This graph is only showing you intimate partner femicide. These pinkish bands here at the bottom, they represent complete alcohol bans. So like in the previous slide, periods during these 52 weeks during which there were no alcohol sales at all. In the first period, it was accompanied by a stay-at-home order. In the second period, it was no alcohol sales and a night curfew. And you can see that these pink bands occurred during 4 periods in the 52 weeks. When you look at what the graph is showing you, the first thing that I do want to say is that intimate partner femicide increased overall between 2017 and 2021. So that was the first thing. That was without introducing alcohol and bans and all of these other conditions. So we had an overall increase of intimate partner femicide, and that's important to say that our femicide rate is still problematic, particularly intimate partner femicide. However, when we started to look at this in relation to the alcohol bans, you can see that in the beginning period, when people were pretty much not aware that alcohol was going to be banned, here, right when the COVID period started and there was complete ban on alcohol sales, that the femicide cases were sort of lowish, okay, in terms of the per week cases. Then when you move to the period when we had restricted alcohol sales so people could purchase alcohol, you can see that the femicide cases went up. Again, as we go back into a period of complete ban on alcohol sales, here you can see that and the night curfew, that the femicide cases per week dropped. There was a period between August and December where we had restricted alcohol sales. It was quite a long period of not having complete bans. And here you can see again that the intimate partner femicide cases went up. We dropped again in the IPF cases when the 27th of December ban was implemented just before New Year that I spoke about, and you can see that the cases dropped again. And then they picked up again when the bans were lifted, and we went into a period of no alcohol restrictions. So what this graph is showing us is almost a dose-response relationship between complete alcohol bans and intimate partner femicide. And that is taking into account the fact that people, yes, may have stockpiled after they started to learn the ways of the COVID world at that time, but we still saw a decrease even when that stockpiling had happened, when people had sort of learned how to work the system. And you hear many anecdotal stories around that, around either stockpiling or home brews or creating alcohol and getting alcohol through other means. Despite that, we still saw a decrease. Yes, we acknowledge that there was a complete restriction in movement and staying at home. However, even when the complete restriction in movement was removed and alcohol remained banned, there still was a decrease in IPF. And this really highlights the critical role that alcohol played in the reduction of these cases. So I've only presented this slide because I think this slide really does tell a very interesting story about the critical role that alcohol has to play in femicide, and particularly at a period of violence, at a particular period in this country where we are needing really convincing evidence around femicide and alcohol. I'm going to move on because my time is moving on. So I was asked what works, to address alcohol use. And there are 4 bands of areas that I have put out today. The first one is structural and policy interventions. And that looks like restricting the availability on the days and hours of sale, restricting the number of or concentration of alcohol outlets, in other words, reducing alcohol outlet density, and making alcohol much less affordable through things like pricing and taxation regulation. And also banning alcohol marketing and alcohol marketing in particular. And we have partial bans, but not total bans, and we've been advocating for that. The second group is around group interventions and peer-led interventions. And in high-income countries, we've seen that group interventions like Alcoholics Anonymous have actually been shown to help and be effective in helping through a peer-led model in helping to reduce alcohol. There are also individual interventions, including brief interventions such as motivational interviewing. This is sort of a therapeutic intervention that works one-on-one with individuals who drink harmfully or have alcohol dependence problems. And they typically include feedback to the person on the alcohol use, the potential harms, and the benefits for reducing their drinking. And a recent systematic review actually found that brief interventions among men and women participating, that they actually drank less compared to a comparison groups who did not have brief interventions. And then, of course, there are community level interventions. With community level interventions, it's important for us to know that there are various ways in which we can make communities safer. And I think this is the point at which I should say quite strongly that none of these bans or these broad areas that I've spoken about should be seen as individual approaches. They actually exist as part of a suite of interventions, and they should be complementary. So if you want to make a community safer around alcohol and alcohol-related harm, it has to exist within a structural and policy environment that supports that. And that's really important for us to remember. Having said all of that, very few gender-based violence prevention programs actually explicitly address alcohol use. And it's important, it's actually a call to action for us working in the field to become much more intentional about including GBV programs, including alcohol programs into GBV programs and vice versa. So, having said all of that, I think what we can conclude from this short presentation is that alcohol is a salient risk factor for intimate partner violence and for femicide. We can no longer deny this. We can no longer contest it. If anything, we should be doubling our efforts in ensuring that we address this. Other drugs are also a risk factor, and we know less about this, but it's important for us to be able to investigate this from a research perspective. And that interventions aimed at reducing alcohol and other drug use may actually lead to reductions in IPV and femicide. And we've seen this in some of the intervention work that we've done. And finally, I was asked, what are the implications for policy and practice? And I hope that this will form the basis for some discussion, is that we need to intervene in an integrated manner across sectors. Like we're doing today, we're working with violence prevention, gender-based violence, alcohol, and this is really a good start. And we must do this on the continuum from prevention to treatment. Effective alcohol policy and legislation must be meaningfully implemented and monitored. And for many of us in the policies, watching this policy space, this is not being done to the extent to which it should be. Alcohol is ultimately a commercial determinant of health, like tobacco and guns, and it requires a whole of society approach, including actively lobbying for policy reform as part of this preventive approach. We are definitely the targets of the alcohol industry, vociferous efforts by the alcohol industry. And so we need to always be pushing back on that. I think in terms of its relationship to IPV, we must push back on the normalization of men's drinking as a form of expression of masculinity and change the narrative around that. And we should certainly be drawing on the voices of women to understand the broad impacts of men's drinking on them. Thank you very much. Back to you,
Leane. Thank you, Leane. Wow, thank you. What a comprehensive and very informative presentation. And I see the hands from the participants as well. And I saw that there was a question in the chat, which we will come back to during the Q&A, but you can also feel free to sort of respond to. And I'm sure there are also other bubbling questions or reflections that I hope people will either put in the chat and we will come back to them after Hellen is presented. So now it's my pleasure to introduce our second speaker, Dr. Ming-han Hellen Motloung. She's a public health medicine specialist with over 16 years experience in health systems, surveillance, and data-driven decision-making. She led provincial surveillance and COVID-19 vaccination in the Free State and later supported HIV and TB improvement work through the Bill and Melinda Gates Foundation. And she now serves as the Western Cape's Violence Prevention Unit where she supports research, data systems, and provincial rollouts of the Planet Youth program, which looks at strengthening adolescents' well-being and reducing risk factors for violence. And today she'll be sharing more about their program and the recent survey that they did with youth in the Western Cape. Over to you, Hellen.
Thank you so much, Cindy, and thank you, Leane. Thank you for this opportunity to actually share what we found. Let me just get the technical stuff sorted. Hopefully this is getting going. Yell if I am. There we go. We're all good?
Mm-hmm.
Awesome. So thank you so much for this. I'm presenting on behalf of the team, our team who actually worked and did all of this data collection. So today I'm presenting on Voices of Youth on Substance Use. And then this, I always like to start with this quote because it just makes us need to pause and think a bit. When you spend years responding to problems, you can sometimes overlook the fact that you could prevent them. And I mean, with us, all of us, we seem to always be, in a rush and trying to finish things, and especially this time of the year. But I'm just thinking sometimes perhaps we need to stop and pause and wondering what is the upstream causes that we can change to actually, instead of mopping them up all the time. So just a quick fly through the methodology. So we looked at reaching our youth through different ways. We did an anonymous online survey from April to June 2025. We targeted the grade 8 and 9 students, and we did it during school hours. We have great collaboration with the education department, really grateful for that. And so we did all the public schools. This was a convenient sampling, so all the schools that was ready in the areas, we included them in the study. So it wasn't every school. So it was facilitated by our trained planeteers, which they are youth as well, to facilitate the session so the youth can feel comfortable. And we told them it is voluntary and also that it's anonymous. This has gone through with parental consent, of course. We sent a letter to all the parents to tell them this is what we're asking the youth, and if they're willing for the child to participate, otherwise they can sign the letter and refuse participation. So just a quick oversight, we did surveys in West Coast District with a 94% response rate, Cape Metro, and also the Garden Route area with a 90% response rate. This, as already Senzi mentioned, 123 schools with 49,094 learners that answered. So just a quick overlook for our metro. 15 schools in Klipfontein, Mitchells Plain, 15 schools, 5 schools in Atlantis, Kraaifontein 14, and Nyanga Guguletu Philippi corridor of 19 schools. So all above 85% response rate. So there were slight limitations, of course. This is of course, convenient sampling, focusing on grade 8 and 9s. Everyone asked, why not younger or older? We're thinking this is a change between, grade 6, 7 to 8 and 9. So there's that shift between primary and high school, and also want to see what are the risk factors before they go into, and prevent them before they get to, 11, 12. So this is all self-reporting, of course, and this is what the learners are saying. So just a quick overview on the findings. So what we are presenting is just a part of the data, so not everything. So I'm going to present on substance use, but I just want to give you a quick overlook. So as you can see, the number of participants, there are 47% that are boys, 52% girls, with a total of 47,813. This is after when we went through the surveys and it was cleaned by the Planet Youth team in Iceland. So just a quick look at the age distribution. 74% are between 14 and 15-year-olds, and 24% are 16 and above. And we have a few that is 13 and below. This is just an overlook at the Western Cape, the answers. As you can see, we did surveys on different parts of our youth. So looking at youth well-being, leisure time, school, and substance use, which I'm going to focus on. Looking at well-being, one of the things is 66% sleep 8 hours or more at night. And a bit concerning that only 66% of our girls say their mental health is good or very good. And with the leisure time, we can see that the 42% participate in choir, 49% outdoor activities, and 21% stay outside later than 10 p.m. With school, 79% feel that they are safe at school, which is quite high compared to the other surveys. And with that, they think 68% think that the adults care about them at school, and 84% actually enjoy school. And I will focus on the substances as we go along, more in depth. So that is a quick overview. So I'm not sure who has teenagers. I have one. Between 10 and 11, something goes on. And by the time they hit the 13, 14-year-old phase, all the emotions and physical changes erupt. And you wonder, like, what happened to my cute little girl? So they change into a more interesting human being. Adolescents are not mini adults. They are actually younger version. So they all their body and their hormones are changing. So when we look at substance use, they're not younger adults using substances. They're actually growing children. So when we think about substance use, we need to keep that in mind. So if we say, like, we looked at adolescents using cigarettes, so smoking daily, we can see that although it is 5%, that is 2,391 learners that are using cigarettes daily. If we look at then e-cigarettes, I'm not sure if everyone seems to have e-cigarettes these days. If you don't have an e-cigarette, it looks like you are not popular. So there is around 14% that is using e-cigarettes daily, which is 6,694 learners out of the 47,000. These are 6,694 that are addicted to e-cigarettes. So I heard a very interesting discussion at another presentation where they said, made me think quite differently. Is the tobacco company allowing our youth to actually use cigarettes and get addicted much more earlier, but then they actually are not that harmful, so they can live longer and make more money? So we need to really think and keep this in mind. With the learners, and that e-cigarettes is not less harmful. With the youth, it actually causes even more damage. It's not saying that it's okay compared to smoking. If an adult smokes and goes on to e-cigarettes, maybe that's slightly more better, but not saying tobacco is good at all. But with learners using e-cigarettes, it's not saying it's less harmful. It's actually harmful as well. So looking at then, when we asked the question of nicotine pouches, I had to go look it up. Apparently, these nicotine pouches are used by learners to actually get the kick and focus and get calm. These are such new things for me. So with this, 1,434 learners are using that daily. So nicotine is actually, so they put it in their mouth and it dissolves. And we need to also think about long-term factors such as oral cancers. And this goes for vaping and cigarettes as well. What are the long-term factors for lung disease? Looking at our Oka pipes, which is Hubbly Buddies, as you can see, 4,303 learners use daily. So in Oka pipes, they can put anything in them, and we don't know what our youth is putting in there to smoke and get that kick. So just having a look at where they get all their vapes and smokes and nicotine pouches, this is what the worrying point is, that they get it in the shop. 60% of them. So we need to really think, as already Leane presented, what are we doing with policy and the strengthening and support of that policy, that our youth below 18 cannot be accessing this. So just to rethink, just to come back to that fact that this is children below 18 getting sold smoking vape and nicotine pouches. So substance use of alcohol. So 23% tried alcohol at the age of 13 years or younger. 26% of our youth has been drunk in their lifetime. 34% a family member gives it to them. 54% drinks it at a home of others, and 35% an adult gives it to me. So what is the social norm we have in families and friends and, you know, social gatherings? Is it a norm that we've made that our teenagers get alcohol? 54% gets it from a bottle store. So this comes back to policy. Are we strengthening and enforcing it enough to actually do that? 27% at a shebeen or club. We always thought maybe 54% means everywhere, but actually there's other percentages where they get it from. So it's interesting to look at 14% after training, tours and camps, 51% after exams. So we need to start thinking, what can we do for our youth to relieve that stress after exams instead of alcohol? And 72% on public holidays. What can we do with our youth that they don't need to drink in public holidays? And 43% from school, from their friends or schoolmates, which probably got it from a bottle store. So looking at dagga use, 2,869 of our youth is using dagga daily. And we need to think like, why do they need to use dagga daily? And also at the fact, we heard that maybe some of these dagga that are sold to the youth are laced with something else to make it more addictive. And also, I heard that it was 4 rand per packet. So I'm just thinking maybe I should ask someone where they get this 4 rand. Anyways, so this is actually slightly concerning as well. Now, looking at the other substances that our youth are using, over-the-counter sleeping pills or tranquilizers. Why does youth need sleeping tablets? I understand us as adults, maybe we need to sleep sometimes, but our youth using sleeping pills is a concern, and we need to really look into the behind the scenes, like the mental health, and higher in girls of 13%. Then we look at homemade beer, which is 17%. So youth is using homemade beer as well. And then cough syrup containing codeine, 15%, which is something, are youth using substance to cope? You know, even if they say their mental health is well, is it because they're using substance, or is it because it's actually well? So to touch on 13 years old or younger, why it's important, because if we know that these substances has high rate of addiction, so meaning if they're using 13 years or younger, what is happening then forward? Looking at then alcohol with 23%, cigarettes 11%, e-cigarettes of 19%. We really need to think about the industry and how that is going. And I saw this clip where the teenagers are saying, you know, we started with it because it was fun. We got into the, you know, friends, and then they know all of the health issues, but their response is, we don't know how to stop it. And we're addicted to it now. So we need to actually think, do we need now teenage rehab to be considered? So protective factors. Just to have a quick look at our parental engagements. We always think as parents of teens, they're not listening, and you know, sometimes you say something and it goes past them. But this actually shows quite interesting facts. Feeling safe at home, 93% of our teens feel safe at home. 75% feel that it's easy to receive care and warmth. 77% often or always spend time with their parents on weekends. Parental rules and expectations, as you can see, 91% disapproves of drunkenness, 94% disapproves of dagga use, and 82% set rules for their teenagers. We're going to come to that now. Parental monitoring, 85% knows where their teens are in the evening, 82% knows of who they are with. So why is this important of us monitoring them like a hawk? So, as you can see, substance use associated spending time with parents on weekends. As you can see with the blue arrows, they're less likely to be drunk using okka pipes or dagga if they're spending time with parents. If we look at parental monitoring, they're less likely, again, to be drunk using okka pipe or dagga, and it's almost half of the risk if they're actually monitored. Looking at rules, also, when they have rules all the time, most definitely less usage. If they have parental care, Also, as you can see, compared to quite easy to receive care to difficult, easier to receive care, less substance use. Looking at parental reactions of what happens when parents know or react to when their teenagers are drunk, much lower when they don't like it and higher when they actually don't mind. So as you can see, drunk in the last 13 days, 12%, you know, we still have children that still want to do what they want to, but 37% gets drunk in the last 30 days if the parents don't mind. So looking at this, with Ocker pipe use, 18% versus 36%, Dacha use, 9% versus 22%. So our reactions as parents still matter. So this really made me think, you know, how can we strengthen our parents and support them to say, you know, and make rules and boundaries for our teenagers. So looking at getting alcohol from a family member associated with parental reaction, as you can see, 63% never consumed alcohol when their parents said no. This is just to look at our living circumstances. We know our teenagers live in different households and different units. As you can see, 40% of them live with both parents, 35% with one parent, the mother, and 4.6% with one parent, father. And of course, we have our grandparents, which are very supportive. 6.7% live with their grandparents. As you can see the numbers below, it's quite low, but I wanted to just also make aware of that. Living with different arrangements, meaning family, with fostering and things, 366. My living on my own or with siblings, this is children-headed households. That is 284. Living with my friends, 261. These are children-headed households. So just to keep that in the back of our mind. Looking at the family dynamics, I just want to look at drunk in their lifetime. When they live with both parents, it's 22%, but when living with different arrangements, siblings or friends, it's above 30, with 36% in different arrangements, 39% with siblings. That's drunk in their lifetime. So looking at assaulted by adults, sexual violence, and sex with more than 5 people, as you can see, living with both parents is a protective factor. And then it goes higher. Living with different arrangements is 42% assaulted by adults. Sexual violence, you can see living with friends is 22%. And having sex with more than 5 people. We need to keep in mind these are teenagers. 5% living with both parents, 22% with friends. So how do we support our teenagers or actually let them access to have an adult who is a mentor? How we can actually prevent risk factors such as these. So looking at other more protective factors, just want to say we've seen that 84% enjoy school and 79% feel safe, and 74% say that school helps them to achieve what the goals matter. And looking at adult support, 68% think that adults at school care about them, and 71% knows where to get help. So looking at then student caring about each other, 50% says my school students are nice to each other. With that, looking at then, it's a slight protective factor, where as you can see, drunk in the last 30 days and occupied use and dacha use are slightly lower when they feel that their friends or the other students are more caring. So how do we improve the protective factor and enhance that? So looking at risk factor, these are things that we can see that maybe we can decrease. Looking at school collectiveness, 31% are bored with school. So I guess children, we all sometimes need to be a little bit more entertained. 52% find schoolwork is difficult, and 29% wants to change schools. So looking at wanting to change schools, we actually saw that there's actually an increased substance use in the last 30 days. So I'm just going to go back to that. As you can see, higher substance use in the last 30 days when they want to change schools. So what are our teenagers doing? In their leisure time, we see that 19% of them participate in choir, drama, or dance 3 times a week. What are they doing with the rest of their time? So we're going to go into a little bit deeper just now to see that participation in adult-led activities does not actually guarantee protection against substance use. As you can see, substance versus participation, which I'm going to go in a bit more just now. And then 21% stay out past 10 p.m. on weekends. 37% of our teens spend time at their friend's house without adult supervision. And we can only wonder what happens there. And 47% of our teenagers spends time in fields or parks without adult supervision. So we need to think how we can create safe spaces for our teenagers. How do we make these parks or fields safe spaces and with activities that teenagers enjoy? So now I'm going to go into substance use and adult-led activities. Just a quick look at this. As you can see, with teens actually associated with sports, looking at 3 times a week, 1 to 2 times a week, or never, it's actually higher use or almost equal use of substance use. This is just doesn't mean sports is not a protective factor. It's actually what happens during sports and all the games. And as we know, we have a culture of, when the rugby comes or soccer comes, we have a great party, we have beer, what's being advertised, who's being supporting the sports, it's energy drinks, it's alcohol. So what is that saying to our teenagers? Is it okay? And also what happens afterwards? Do teenagers then celebrate with alcohol as well? And we saw that, with alcohol, where they get it, it's during after sports events and activities. And then looking at participation with adult-led activities outside, as you can see, the participants have higher use in substance than the non-participants. So we have to start seeing what is the cause of this and where and what is the culture of these things. And of course, if our teenagers are out after 10 p.m., more substance use. So monkey see, monkey do. We know our teens are affected by their peers, a lot of peer pressure and also wanting to fit in. I think even for us adults, we are there as well. So are they saying that their friends are doing? So most of their friends are doing the following: smoking, 7%, vaping, still there, 20%, drinking alcohol, 16%, occupies, 13%. Pressure to fit in. Why the percentage of our teenagers using substances to fit in: drinking alcohol, 17%, occupied, 70%, daha, 12%, vaping, 18%, bunking class, 14%. So how do we create a space where our teenagers can be themselves without needing to fit in, without substance use? And this is an interesting one: increasing substance use when perceived that peers get drunk once a month, meaning the perception of my friend using or getting drunk once a month, or my friend maybe wants to be cool and telling me that they get drunk once a month, increases then the students or the teenagers being drunk, 46% being drunk using occupied, 45%, and daha, 30%. So just perceiving their friend using substances increases their use. So this is the last one, just a quick one, with looking at then substance use in the last 30 days versus violence. And as Leane already mentioned, on the increased violence with alcohol use, as you can see, with daha use, it is 21% of users assaulting someone versus non-users. Alcohol use, 29% versus 11% of non-users. And occupied use is 34% versus 16%. So the provincial one is the one in brackets. As you can see, it's much higher being of violence when they use substance. And we're always wondering what is in the occupied that is making them more violent, or the content thereof. So this was just how we have disseminated our data. We are very grateful and very we worked with so many departments, and we disseminated to the social cluster with different levels of dissemination, which is a provincial level, which we did sense making with different collaborators, with WCD, with Department of Social Development, with the Department of Cultural Affairs and Sports, with civil society, and it was a wonderful collaboration with even local municipality, the commitment that everyone has given with this data to make sure that their youth is actually looked after. And with the way forward, we are still doing community workshops next year with 12 communities to actually disseminate and start looking at how we can work together to have interventions. So health is not alone, that we work with education, with DSD, with civil society, and everyone to actually make a difference. So even with us, thinking about us as parents, this actually made me think a lot about how I approach my teenager, and, you know, just sitting there and not being on your phone or your laptop and just focusing on them at night and just giving them a bit of attention and support actually decreases substance use. So it's a win-win. You get to spend time with your kids, and also at the same time, you know, you prevent them from doing everything else that they shouldn't be. So thank you so much. That is from my side.
Thanks, Helen. Thank you. Wow. It's amazing how both the presentations sort of reinforce each other. And I'm glad you ended where you ended, because I was part of some of the dissemination workshops, and I remember you were giving away fridge magnets, which I hope people could see, that different participants and parents could take, and they have messages on them. One of them reads, "Every day I tell my child I love you. I put down my phone and I spend time with my child." So it's just many ways that you've tried not only to share the results, but also to promote the protective factors that you have been talking about, especially parental involvement and engagement with their children and their teenagers. So thank you. So we've now gotten to the Q&A session. And just to alert everyone that we do have a very short survey that we do, which may pop up in between our Q&A session. And we do this just so that we can know what has been valuable for people, and we can know what else maybe we need to sort of think about and improve on when we do these webinars going forward. So when it pops up, we'd be really grateful if you can fill it in. So I know, Leane, there was a question for you in the chat that Mark puts around, why do we always only refer to men as perpetrators when we talk about GBV? And I'm not sure, Mark, if you would like to come back and just elaborate on the question. And I also had a question for you, Leane, as well, just around elaborating on, as you've done this research as the MRC, and also with the research and experience that you have, what are other research gaps and opportunities that you're seeing on how we could build on what you have done to sort of build this picture of understanding what are the drivers of substance and alcohol abuse, even if we look across genders? And a question to you, Hellen, is two parts, because I have some sort of background around the Planet Youth intervention. So I was hoping you could share a little bit more about the intervention itself and where it's drawing from, because I think it's very helpful to know that, you know, this is a global issue, and also we are drawing on what has worked elsewhere with trying to do this survey. And I'm also curious to know how the reaction has been, especially at the district and school level, to some of the findings, because I know you do present them to each school, and you will give a picture of what each school's children, you know, said and how that looks like. So I'll pause there and hand over to Leane to respond, and then we'll go to you, Hellen, and then take another round of questions in the room. Over to you, Leane.
Thanks very much, Senzekile. And Mark, thank you for the question. I think it's a really important question. The reason that men are often referred to as perpetrators of gender-based violence is really based on consistently what we've seen in research, in practice, that the majority of GBV incidents actually occur, and particularly intimate partner violence, sexual violence, are committed by men against women. So men as perpetrators does not mean that all men commit GBV, but it highlights sort of a systemic trend that we've seen in all of the research that we've done, in the same way that women are referred to as survivors or victims of gender-based violence. I'm not sure if you want to come back in or if that's adequate. Senzekile, I am going to ask you to repeat your question because there was quite a lot in there.
Thanks, Leanne. Mark, just checking in if you maybe would like to come in. Would appreciate maybe a thumbs up just to see if you've been covered. Okay. I hope that Mark is still with us, and thanks, Leanne. I know that we even just got a notification, so it is being recorded, and I know he can come back and maybe share, elaborate on the question or refer back to something that you mentioned in the presentation. And my question was just around opportunities for further research, just building on what you've done so that we can better understand this issue from various perspectives. So if you can just elaborate a bit more on that.
Sure. Thanks, Senze. So I want to actually take us back and maybe, thanks, Mark, I see your thumbs up, and take us back to some of the issues I was talking about, particularly in the final slides. So I had presented around the issue of 4 broad areas that we know have worked. I think the first thing is that we need to continue to really push the policy agenda on alcohol use and on harmful alcohol use. As part of that process, we have just started another collaborative called Chase SA, which is it's a collaboration looking at harm reduction, alcohol harm reduction in Southern Africa. And what it does is it really begins to grapple with this question of what are the political and commercial determinants of health. I think I had mentioned in my presentation that alcohol is certainly a commercial determinant of health. And that's partly because it's driven by industry. It's driven by pricing, it's driven by product, marketing, built on business models, and it is vociferously targeting the African market. So I think what's important is for us to continue to work out how it is that we counter the efforts of the alcohol industry in actively recruiting women and young people. And when I say that, you look at the pink drinks and you look at these very attractive packaging of drinks and alcohol advertising, etc. That is ubiquitous in the country. You step out of a plane, you see that alcohol billboard. You step out of a bus, it's on the back of the bus station and those types of things. Social media is something that we also really need to start interrogating. And I want to just talk a little bit about that because while we have for a long time spent quite a bit of time getting our heads around some of the alcohol marketing through the mainstream, we know much less about social media. And that is something that is pervasive, particularly in relation to what Hellen is saying around targeting youth and quite, understudied. The other thing that I think we need to look at, and I've mentioned this already in the presentation, is we're moving now away from having to contest the role of alcohol in intimate partner violence. And we are now moving to, I think it's no longer an appropriate discussion to say that alcohol is not at all implicated or should not be considered in IPV. And I think that's a win. However, we need, particularly in South Africa, given our high femicide burden, to do much more work around understanding the role of alcohol in femicide. And remember, I spoke about I spoke about femicide as being all types of femicide, and then intimate partner femicide, as well as non-partner femicide. And I think it's time that we shifted the needle a bit on understanding that alcohol's role in femicide. I also think that there's another area that is really an opportunity for us. It's an area I've started working a bit on, which is alcohol's harm to others. So a lot of the work that has been done in the biomedical sphere over the last few decades has been around the role of alcohol and the harm to the drinker. But increasingly, we're starting to see that there's massive harm, both direct and indirect, to people around them. And that encompasses both partners, like I've spoken about today, but also family situations, children. It has huge implications for children in terms of their educational attainment, in terms of their bonding, family cohesion, just general mental well-being. And so it's important for us to begin to move away from focusing just on the harms to the individual drinker, beyond to the people around the drinker who are also harmed. And then I think I'll close off that point by saying that sometimes the harms that we look at are obvious. You know, someone drinks and they cause a pedestrian accident, or they cause a car accident, or they physically beat their wives or their children or other family members. But often there's these hidden harms that we know less about, and we hear much less about. And it's important for us to begin to frame alcohol as an issue that causes hidden harms that do need to be brought to the fore. Because in studies that we've looked at more recently, there are things like shame and stigma that are associated with being attached to a drinker, whether you attach to a drinker as a child or as a partner or as a sibling, social isolation, embarrassment, and a whole range of other things. So I could speak for a long time about the areas we can focus on, but I'm just going to touch on those few areas. I hope that's okay for now.
Thanks, Leane. Thank you. Hellen, I'll give you the last response to the two questions, just more around the Planet Youth intervention, as well as just some highlights on how the schools are responding to seeing the survey results. Over to you.
Thank you so much, Senzi. So maybe just to touch on what Leane is saying about social media, I didn't put it here because we were talking about substance use, but youth actually, it's around, we've seen that 23 to 27% of youth uses 6 hours or more on social media. So if there's substance targeting and things like that, that'll be a very interesting way for, targeting youth at that. And then looking at then the model, it's an Icelandic model done in Iceland, of course, because of the high substance use that is happening in the youth on that side. But we also know that youth and versus in Iceland versus youth in South Africa, Western Cape is quite different because of the context in the society that we live in. So with the survey, we adapted a few things for our own context to make sure, we capture certain of the nuances, such as violence and transport and all those other food insecurities that in that as well. And with the dissemination of the data, we have started disseminating it to the schools. It's only the beginning. Hopefully it'll be done throughout next year, and that will be done. But we have shared with the different districts like Metro, West Coast, and Garden Route, and getting the different stakeholders together. And for example, in West Coast, the mayor actually were in the panel discussions was like, you know what, we will be sending people to all the stores and sending champions to make sure that the stores do not sell, all these substances to the youth. So we have the buy-in of higher levels, which is amazing to see how much, everyone cares about the well-being of our youth. And as for schools, we're slowly disseminating. I think all the schools are accepting it well. And of course, first glance of this data, you're like, and then afterwards you're like, okay, is it really true? Is this what our youth is saying? So yeah, so hopefully, so with this, the Planet Youth is not an intervention. It is actually a framework and a source, a way of collecting data from our youth. So we are using this framework and this vehicle of data collection to share with all our collaborators, with the different departments to say, this is what they're saying for family, this is what they're saying for education, this is what they're saying for leisure time. How do we come together with the same priorities of wanting to improve the health of youth? How do we come together to have the same interventions and not, duplicate resources and actually make a change for our youth? So hopefully I've answered your question, Senzi.
Thanks, Hellen. Wow, that's amazing to hear. So with that, I am just so pleased to express gratitude to both you, Leane, as well as Hellen, for your amazing presentations today, and to our participants who joined, and to those who will also be watching the recording and who have joined us on YouTube Live as well. I think the top insights that I'm taking away, exactly as you said, Leane, is that the evidence is very clear. Substance abuse is an issue and is a driver of femicide, and it is a worrying concern when it comes to youth well-being, and that this data is actually giving us rich analysis that we can use to actually intervene. And so it's a call to action to all of us as stakeholders who are concerned about issues of gender-based violence, femicide, and youth well-being, to be connecting to these studies and saying, what are they telling us about where we could intervene and how we could intervene? So thank you all. And I wish us all a healthy and safe holiday. And thanks for joining the webinar. The recording will be available on YouTube, and we will be sharing it as well on our platforms for those who couldn't join us today. Thank you.
Thank you very much.
Thank you. Bye.